Time for this week's segment of Happier at Home. This week we're discussing aging with varicose veins.
We are, and this morning we are joined by none other than Deb Marcello. Good morning, Deb. Thanks so much for waking up with us.
Good morning. How are you?
Very well. Where are you today?
I am in Cape Vincent, New York at my cottage, and it's so beautiful out here already.
Wow, gorgeous background.
Yeah.
We like that. We like that. All right, so let's talk about this. Varicose veins. I suppose it's an important topic, but it's not one that a lot of people, talk about outside of with their doctor, maybe.
Yeah, it is, especially men. Men can have varicose veins, and they don't seem to really address it too much. But varicose veins, in addition to cosmetically being displeasing for some people, sometimes they could be really uncomfortable. And so being able to identify things that put you at risk for developing varicose veins is important, so you could control those controllable risk factors, but then also knowing when you really should get medical attention. Usually they are cosmetic, but sometimes they can become painful and they could cause other problems. But the types of things that put you at risk for developing varicose veins are being a woman. If you also are older, as you get older, what happens is there's blood that goes into your veins, and you have valves, and the valves actually help pump the blood up your vein. So as you get older, those valves become a little weak, and so they fail, and the blood pools in your veins, and that's how you get those larger looking veins in your legs. Also, people may develop them with family history, if you're obese, if perhaps in the past you've had children also, that puts you at risk. So just anything that really increases that pressure on your veins will put you at risk for developing them.
So, Deb, there are ways you can kind of help ease some of that discomfort, right? I mean, compression socks and stuff like that?
Yes, wearing compression stockings, even if you're even prone to them. I know when I was an emergency room nurse, I loved wearing compression stockings because I was on my feet for 12, 13 hours at a time. So wearing those compression stockings helps to support the veins, so it doesn't pool in your legs as much. Putting your legs up helps as well. But definitely things that you need to keep an eye out for is with these varicose veins, sometimes you could develop ulcers over them. You could develop blood clots within those veins. And then also with some of them that are really superficial or at the surface of your skin, you can develop bleeding. Sometimes it's just minor bleeding if you break your skin, but I've known it to be a major problem for some people that have broken these varicose veins, and it's hard to get them to stop bleeding. So those are things that you really should seek out medical treatment for. And if you talk to your primary doctor, he or she can refer you to the appropriate physician to be able to take care of these things. And there might be options that are pretty minor, depending on, they have to assess you and see what would be appropriate therapy for you.
Those ulcers, Deb, that's not something that I ever heard of from varicose veins. Is that something that could actually break through to the surface of the skin?
Yes, and what you kind of look for is some discoloration over the area of the varicose vein. Sometimes the skin starts turning dark, or it can be red also, or a combination of that. And so it will develop over that. And what is happening is you're getting a lack of blood flow to that area. And so it will develop into it could develop into an opening in your skin.
Wow.
So making sure that you're just knowing your body, keep track of what's going on with those veins. I mean, it's a very common thing, and a lot of people have things like sclerotherapy done. They could inject like a saline or a salty solution into your veins, which kind of irritates the inside of the vein, and then you wrap those veins nice and tight. And so when they heal, the two walls of the vein are pressed together. It's not, sometimes some of these therapies are a little uncomfortable, but sometimes they just take a while to treat them as well. So, but there are a lot of different types of therapy. You do vein stripping, you might have heard of that. That is a little bit painful. And thermal ablation. I mean, they could use lasers nowadays. So there's a lot of different therapies out there. And, for people who just want it for cosmetic purposes, hey, that's fine. You could do something like that as well.
All right, Deb, we are just about out of time. Real fast, your website where people can find more information?
We'll post this blog on our website at happieratHome.com, and you could always give us a call or email me for more information too.
Perfect. Deb, thanks so much. We really appreciate your time this morning. Enjoy the cabin.